I thought I was totally prepared for labor. This is Hillary before her first baby. I had taken the classes, I had read the books. Me and What to Expect were BFFs. But when labor hit, I realized that I literally had no idea what I was doing. I had no idea how to manage early labor. I had no idea how to make choices during labor. And let's not even get started about my postpartum journey. I want better for you. And just in case we haven't met yet, I'm Hillary, I'm the pregnancy nurse, but today I'm coming to you with my mom uniform on, a t-shirt and jeans, because this is something that my eyes went wide open when I became a mom. So let's talk mom to mom. So here's what I wish I had known going into labor on the first time, and it's what I teach as a labor and delivery nurse to help people feel confident going into their labor and postpartum. Okay, there are three main things that I wish I had known going into labor. And the first one was how to labor at home. I gotta tell you, we just didn't have any clue what we were doing. They ultimately said when labor starts, go into the hospital, which is what I did. And if a lot of you do that, you're also going to be sent home because the safest place for you in early labor really is at home. In the hospital, the longer we watch you, the more likely we are to start interventions. So being at home was the best spot for me, but I kind of felt dejected when I went home, and I literally had no idea how to help labor progress, what my husband could be doing to help me out, and honestly, when to go into the hospital next. So I wish I had known a little bit more about that. I think partners really have a hard time during that early labor segment. And so they really need to know what to do to help you labor at home effectively. They're sort of like your team. Like in the hospital, you're gonna have nurses, anesthesia, your doctor, but at home, you've got your partner. So they really need to be a team member in early labor. Make sure that you are learning what to do in early labor. It's gonna be a huge help. My biggest pro tip there is to sleep. So many people are like, oh my gosh, labor is happening. And so they don't sleep. But if there's any way that you can actually sleep, I mean actual sleep, not resting your eyes like your mom might do, sleep. The next one is to make choices for myself. I was young when I had my first baby. I was a nurse, but I really wasn't experienced in the hospital. I worked in a nursing home at the time, and I didn't know how to ask the doctor questions to make the best choice for me. And I slowly just floated along on the doctor's stream, just kind of having them make decisions for me. And in a lot of cases, those decisions were correct. I had a forceps delivery on my first birth. I think that was correct because I know the baby's heart rate was going down. But there were a lot of things that I should have been a little bit more engaged in my care, and I wasn't doing anything to help that. I'm sure I looked like a deer in the headlights when they tried to talk to me about my options. I was just kind of like, whatever you want to do, because I hadn't been informed on how to get the information from my provider and then make choices for myself. I also didn't know all of the options, which on this YouTube channel, I'm going to be making lots of YouTube videos about different choices that you have, so stay tuned for that. Before we keep going, is there a choice that you sort of think your provider made for you and you weren't making it? Tell us down in the comments. I actually encourage people to start making choices from the very beginning. Your provider orders that first ultrasound, you ask why we're doing it, what we're going to learn from it, and ultimately you make the choice to go to the ultrasound. Remember, providers order the techs to do the ultrasound. They're not ordering you to do the ultrasound. That is always your choice. And of course, the end point looks the same. You end up getting the ultrasound. But I just want you to be engaging and making choices for yourself from the very beginning. The last one is my postpartum journey. I had no idea what to expect when I went home. Again, I took a birth class, but they were just like, then baby will come out and it'll be like sunshine and rainbows for you and that baby, and everything will be great once the baby is born. And yes, it was amazing when that baby was born, but bringing it home had all sorts of things I wasn't prepared for. Breastfeeding was more difficult than I thought. Taking care of my bottom was more difficult than I thought. That first BM, which I have a video on, I'll link it down below, was more difficult than I first thought. And they didn't review any of that for me. So being sure that you're prepared for postpartum, what you want your postpartum to look like, and possibly recruiting people to help you out postpartum can be a big win. As a labor and delivery nurse of 20 years, I talk a lot about postpartum here on my channel, so I'm so glad that you're here. Now, if you actually want to feel prepared for this upcoming delivery, not just like I have my hospital bag packed or I have some cute onesies for this baby, come join me in the online prenatal class for couples where we prepare you for early labor, asking questions and making choices for yourself. And we have 2 full sections on your postpartum journey, including how to make the most out of your postpartum journey at the hospital, which is an area that I think so many people just entirely ignore. I'm going to put the link down below. So I gotta tell you that once I understood these things, it changed how I approached my next births, and it entirely changed how I teach patients and students about labor, birth, and postpartum. You know, sometimes I look back and think, oh my gosh, Hillary, why was that so difficult? But sometimes I think I had to go through that because I've ultimately taught millions of pregnant families how to manage their labor, birth, and postpartum adventure better. Now, making choices in labor can be pretty tricky. I have a whole video on making choices in labor that I'm going to put up here. Thanks for joining us here on The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth.